The hospital staff simply thought of her as a nurse, at least until the FBI showed up, asking for Captain Hayes. The fluorescent lights in the surgical wing of San Francisco General buzzed with that specific hum that signaled the official start of the night shift. Liv Martinez pulled her dark hair back into a severe bun, tucking any stray strands behind her ears with practiced ease. The small tattoo just behind her left ear disappeared beneath the pulled skin and hair, a ranger tab, no bigger than a thumbnail. She adjusted her surgical mask and kept her gaze lowered as she walked past the residence lounge. Dr. Robert Chun stood near the coffee machine, reviewing charts with two senior residents. He was a confident man of 52, with streaks of silver running through his black hair, the kind of confidence that came from 25 years of unchallenged authority. His white coat was spotless, despite the late hour. He glanced up as Liv approached the assignment board. "You're the transfer from... where was it?" His tone carried the weight of someone who already knew the answer but wanted to hear it confirmed. "Community Hospital in Fresno," Liv said. "Yes, sir." Her voice was even and neutral, offering nothing further. 6 weeks in and they're putting you on night rotation already?" Chun shook his head slightly, turning his attention back to the chart. "Must be desperate for bodies." One of the residents, a lanky man named Davidson, smirked into his coffee cup. Liv said nothing. She studied the board. 3 cases were scheduled for the night. An appendectomy in Bay 2, a hernia repair in Bay 4, and gallbladder removal in Bay 1, flagged as routine. "Patient stable." "Martinez." Chen's voice cut through her concentration. "Take the gallbladder in Bay 1. Should be straightforward enough even for, well, Dr. Sharma will supervise." Dr. Priya Sharma, a sharp-eyed, sharp-witted third-year resident, looked up from her tablet. She was 31, with shoulder-length black hair and the kind of observant nature that made her someone you didn't want to dismiss. "I can handle more complex cases," Liv said quietly. Chen's eyebrows rose slightly. "I'm sure you can, but we follow protocol here, Martinez. First-year residents don't jump the line just because they're eager." He turned back to Davidson. "Monitor the appendectomy. I'll handle the hernia myself." Liv nodded once and moved toward Bay 1. Priya fell into step beside her. "Don't take it personally. Chun treats everyone like that for the first year." "I'm not taking it personally." "Good, because that gallbladder case is actually perfect for evaluation. Vitals are clean, patient history is straightforward, and you'll get hands-on time without pressure." Priya swiped her ID badge at the surgical prep station. "What's your background, anyway? I saw your file was pretty thin." Liv scrubbed her hands with methodical precision, each finger receiving equal attention, the motion so automatic it looked choreographed. "Worked in urgent care for a few years. Wanted to pursue surgery." "Urgent care?" Priya's tone implied she was filing that information away. "That's unusual. Most people go straight from med school to residency. I took a different path." The prep room fell into a comfortable silence as both women gowned up. Liv's movements were economical, no wasted motion. "Tie the gown, snap the gloves, check the fit." Priya noticed. Her eyes lingered on Liv's hands for a moment longer than casual observation warranted. They entered Bay 1 at 11:38 p.m. The patient, a woman in her mid-40s named Teresa Vaughn, lay sedated on the table. The anesthesiologist, Dr. Kim, nodded at their arrival. Monitors beeped in a steady rhythm. Blood pressure 120/80, heart rate 72, oxygen saturation 98%. "Routine cholecystectomy," Priya said, reviewing the chart on the mounted screen. "Gallstones causing intermittent pain for 6 months. No complications indicated. Should be a clean laparoscopic procedure." Liv stepped closer to the table. She looked at Teresa's face, then at the monitors, then at the slight distension of the abdomen, visible even under the surgical drape. Something was wrong. She couldn't quite put her finger on it yet. Not in a way that would satisfy someone like Chun, but there was a smell, faint, almost imperceptible beneath the antiseptic and sterile air, a sourness that didn't belong. "Dr. Sharma," Liv kept her voice level, "I think we should run another scan before we proceed." Priya looked up from the surgical tray. Why? The pre-op imaging was clear. The abdomen looks more distended than it should for simple gallstones. Liv pointed without touching. And there's an odor, faint but present, that could indicate peritonitis. Priya moved to the other side of the table and leaned closer, professional curiosity overriding skepticism. She inhaled carefully. I don't smell anything unusual. It's subtle, but it's there. Dr. Kim checked his monitors. Vitals are stable. Temperature is slightly elevated at 99.2, but that's within normal range for pre-op anxiety. Priya studied Liv's face for a long moment. You want to delay based on a smell? I want to confirm we're not missing an underlying infection. The imaging was done 4 hours ago. If there was peritonitis, we'd see elevated white count, fever, rigidity. Priya pulled up Teresa's labs on the screen. White count is 11,000. High normal but not alarming. Liv said nothing. She looked at the patient again, the slight sheen of perspiration on her forehead. The way her breathing, even under sedation, seemed shallower than it should be. She'd seen this before. Not in Fresno, not in any community hospital, but in a field hospital outside Kandahar, when a local woman came in with what everyone thought was a routine appendicitis and turned out to have a perforated bowel and sepsis that nearly killed her. The smell had been the same. I think we should call Dr. Chun, Liv said. Priya hesitated, then nodded. She stepped to the wall comm and paged him. Chun arrived 3 minutes later, still wearing his surgical cap from prepping for the hernia case. His expression was already annoyed before he even spoke. What's the delay? Dr. Martinez believes there may be underlying peritonitis, Priya said carefully. Chun looked at Liv. Based on what? Imaging is clear. Labs are acceptable. Patient history shows no indicators. The presentation doesn't match a simple cholecystectomy case, Liv said. I recommend delaying until we can run a CT with contrast. You recommend? Chen's voice went flat. You've been here 6 weeks, Martinez. You're a first-year resident transferred from urgent care. You don't have the experience to override pre-op diagnostics done by board-certified radiologists. I'm not trying to override anyone. I'm asking for confirmation, which would delay surgery by at least 90 minutes, waste resources, and likely show exactly what we already know. Chun stepped to the table and examined Teresa himself. He checked the monitors, reviewed the chart, then looked back at Liv. Vitals are stable. There's no clinical evidence of infection. We proceed as planned. Sir, I really think that's enough. Chen's tone ended the discussion. Dr. Sharma, begin the procedure. Dr. Martinez, if you're not comfortable assisting, you can observe from the gallery. The room went quiet, save for the steady beep of the monitors. Liv met Chen's eyes. She could push harder. She could refuse. She could invoke protocol and demand a second opinion. But she was 6 weeks into a residency under a false name. With a military background she'd spent 2 years trying to bury, and challenging an attending surgeon on instinct alone would raise questions she wasn't ready to answer. So she stepped back. I'll assist. Chun nodded and left to return to his own case. Priya picked up the scalpel. Ready? Liv pulled her mask higher and moved into position across the table. Her hands didn't shake. They never did. But the smell was still there. And she knew, with the certainty that came from watching 43 people almost die before she brought them back, that they were about to find out she was right. If you want to see what Captain Hayes does when everything goes wrong, make sure you subscribe to Emergency Hero Stories, because what happens in the next few minutes will change everything. Where are you watching from? The scalpel touched skin at 11:43 p.m. Priya made the first incision with textbook precision, a small lateral cut just below the ribs for the laparoscopic port. The procedure was routine, methodical, the kind performed dozens of times each week in hospitals across the country. Liv watched the monitors while assisting with retraction. Blood pressure holding steady, heart rate unchanged, oxygen saturation perfect. But Teresa's skin felt wrong under her gloved hands, too warm. The tissue resistance slightly off. Priya inserted the camera cord, and the screen flickered to life with the interior view of Teresa's abdomen. For 3 seconds, everything looked normal. Then Priya adjusted the angle and they both saw it. The gallbladder wasn't just inflamed, It was necrotic, the tissue blackened and leaking. And surrounding it, spreading across the peritoneum like spilled ink, was infection. Oh God! Priya breathed. Liv was already moving. We need to convert to open surgery now. Priya's hands hesitated over the instruments. I need to call Dr. Chun. There's no time. Look at the spread. Liv pointed at the screen, where purulent fluid was clearly visible, pooling in the abdominal cavity. She's septic. Has been for hours. The infection is eating through the bowel wall. I can't authorize. Then I will. Liv reached for the larger scalpel. Call Chun if you want, but I'm opening her up. Priya stared at her for one frozen moment, then grabbed the wall column with one hand while maintaining her position with the other. Dr. Chun to Bay 1 emergency. Liv extended the incision with smooth, controlled strokes, not the tentative cuts of a first-year resident learning technique. These were the movements of someone who'd performed this exact procedure under conditions far worse than a well-lit surgical bay. She'd done it in a tent with mortars falling 200 yards away. She'd done it with her hands covered in someone else's blood because there wasn't time to change gloves between patients. She'd done it 43 times when everyone else said the patient was already gone. The abdomen opened under her hands, and the smell hit them both. Not faint anymore. Unmistakable. Suction. Liv said, her voice calm, almost detached. I need to visualize the source. Dr. Kim looked up from his monitors, alarmed. BP dropping 100/60, heart rate climbing to 95. She's going into septic shock. Liv said. Kim, start broad-spectrum antibiotics, Piptazo and vancomycin, and get me 2 units of O-negative standing by. I can't authorize. I'm authorizing it. Do it now. Something in her tone made him move. He reached for the 4 lines. Priya was frozen, staring at the open abdomen where Liv's hands were already working, suctioning away infected fluid, identifying bleeding sources, isolating the gangrenous gallbladder with movements too fast and too precise to be anything other than deeply ingrained muscle memory. The door slammed open. Dr. Chun entered at a near run, still in partial surgical gear from the hernia case. What the hell is going on? He stopped mid-sentence when he saw the table. Gangrenous cholecystitis with perforation and peritonitis, Liv said without looking up. Her hands never stopped moving. Infection spread to the peritoneum and likely into the bowel wall. She was septic before we started. Another 20 minutes and we'd have lost her. Chun moved to the table and looked at the surgical field. His face went pale. How did imaging miss this? It didn't miss it. It wasn't there 4 hours ago, or it was early enough to hide. Liv clamped a bleeder with her left hand while her right continued dissection. Gallbladder must have perforated within the last few hours. Progression was fast. You said. Chun caught himself. You suspected this. I smelled it. You smelled it? His tone was flat with disbelief. Yes. Liv removed the necrotic gallbladder in one smooth motion and dropped it in the specimen tray. The tissue was black and partially liquefied. She moved immediately to examining the surrounding structures. Bowel looks intact, she reported. Small perforation in the hepatic flexure, but contained. I can repair it. Chun watched her hands move the way she held the instruments, the angle of approach, the specific pattern of her sutures as she began repairing the small bowel perforation. Those weren't normal sutures. They were interrupted mattress sutures, military style, designed for speed and security in field conditions, the kind taught to combat medics who needed to close wounds fast and move to the next casualty. Where did you learn that technique? Chun asked quietly. Medical school. Liv didn't look up. Her hands continued their work, each stitch perfect, each not identical to the last. Priya was watching, too. Her eyes moved from Liv's hands to her face to the monitor and back. She'd assisted in over 200 surgeries during her residency. She'd never seen anyone move like this. The repair took 8 minutes. Liv flushed the abdomen with sterile saline, checked for additional bleeding, then began closing layer by layer, precise and methodical, the peritoneum, the fascia, the subcutaneous tissue, finally the skin. BP stabilizing, Dr. Kim reported. 110/70, heart rate dropping to 88. Chun checked his watch. 23 minutes from the moment Liv had made the decision to convert to open surgery until now. A surgery that should have taken 90 minutes minimum had been completed in less than a quarter of that time. Dr. Sharma, finish the closure, Chun said quietly. Dr. Martinez, step out with me. Liv glanced at Priya, who nodded slightly. They both knew what was coming. She stripped off her gloves and followed Chun into the hallway outside the surgical bays. He turned to face her, his expression unreadable. That was extraordinary work. Thank you. Don't thank me. I'm not complimenting you. I'm stating a fact that doesn't make sense. Chun crossed his arms. You're a first-year resident transferred from urgent care with skills that would make most third-year residents jealous. Liv said nothing. Those sutures aren't standard surgical technique, airfield medicine, military field medicine. Chen's voice dropped lower, and the way you moved in there, the decisiveness, the speed, that's not something you learn from textbooks or even from observation. I study extensively. Nobody studies their way into that kind of muscle memory. He stepped closer. Where did you really train, Martinez? Before Liv could answer, the wall comm crackled to life. Trauma alert. Multiple casualties incoming. Multi-vehicle collision on the 101. ETA 4 minutes. All available surgical staff report immediately. Chen's jaw tightened. He looked at Liv for one more long moment. This conversation isn't over. He turned and strode toward the emergency department. Liv stood alone in the hallway, her carefully constructed civilian identity beginning to crack under the weight of skills she couldn't fully hide. Inside Bay 1, Teresa Vaughn's monitors beeped steadily. Her blood pressure was rising. Her fever was breaking. She would live. In the residence lounge, Davidson and 2 other residents were pulling on trauma gowns. Did you hear? Martinez converted a lap choli to open and completed it in 23 minutes. Sharma confirmed it. Said she moved like some kind of machine. Lucky guess on the peritonitis. That wasn't luck. That was something else. None of them saw Priya standing in the doorway, her phone in her hand, a Google search still visible on the screen. Military medical techniques, combat sutures, field hospital protocols, and one more search barely begun. Angel of Kandahar. The emergency department looked like controlled chaos when Liv arrived. Nurses ran between beds. Monitors beeped out of sync. Voices called for equipment, blood, imaging. The smell of antiseptic couldn't quite cover the metallic tang of trauma. Dr. Chun stood at the triage board with the ER attending, a tall woman named Dr. Pierce. Her names were already written in dry erase marker, red tagged as critical. What do we have? Chun asked. Pierce consulted her tablet. 5-car pileup on the 101 northbound. 2 DOA at scene. For critical coming to us. First ambulance is 90 seconds out. The automatic doors burst open. Paramedics wheeled in the first patient at a run. Male, 29, Lieutenant Marcus Webb, off-duty Marine. The lead paramedic called out. T-boned by a pickup at highway speed. Massive blunt force trauma to the chest and abdomen. BP 70 over 40 and dropping. Heart rate 130. Respiratory distress, possible pneumothorax. They transferred Webb to the trauma bed in Bay 3. He was conscious, but barely, his face gray with shock. Blood soaked through the bandages wrapped around his torso. Chun moved to the bedside immediately. Get me a chest x-ray and fast ultrasound. Someone page cardiothoracic. Liv stood at the edge of the trauma bay, watching, waiting to be assigned. The second ambulance arrived, then the third. Within 6 minutes, all 4 critical patients were in the department, each surrounded by medical staff trying to stabilize the unstable. Chun was with Webb evaluating the chest trauma. Davidson had a middle-aged woman with a shattered pelvis. Priya was managing a teenager with a severe head injury. The 4th patient, an elderly man with internal bleeding, was being prepped for immediate surgery by Dr. Pierce herself, which left no one for the 5th patient. The automatic doors opened again, and a paramedic crew rushed in with unexpected urgency. We've got one more, the paramedic shouted. Wasn't initially flagged as critical, but he's deteriorating fast. Male, 42, driver of the sedan. Chest pain, difficulty breathing. Initially stable but now crashing. They rolled him into Bay 5, the only empty space left. Liv didn't wait for assignment. She moved to the bedside. The patient was conscious, gasping for air. His lips tinged blue, cyanosis. Not enough oxygen reaching his blood. She placed her hands on his chest, feeling the rise and fall. The movement was asymmetric, the left side barely moving. "I need a stethoscope," she said. A nurse handed her one without question. Liv listened to the lung sounds. Right side clear, left side silent. No air movement at all. Tension pneumothorax. Air trapped in the chest cavity, collapsing the lung and shifting the heart. Fatal within minutes if not treated. She looked up at the monitor. Blood pressure dropping. Oxygen saturation at 86 and falling. He needs a chest tube now. Dr. Pierce looked over from 3 bays away. "Who authorized you to assess that patient?" "No one. But he's got a tension pneumothorax, and he'll be dead in 3 minutes if we don't decompress." Pierce hesitated, calculating. She was managing her own critical patient. Chun was occupied. Everyone else was tied up. "Can you place a tube?" "Yes." "Then do it. I'll supervise from here." Liv turned to the nurse. "I need a chest tube tray, size 32 French, betadine, local anesthetic, and someone get me a portable X-ray for confirmation after placement." The nurse moved fast. She'd worked enough traumas to recognize certainty when she heard it. Liv positioned the patient, palpating his ribs to find the 5th intercostal space at the mid-axillary line. She cleaned the site with betadine in quick, circular motions, injected lidocaine, then picked up the scalpel. The incision was smooth and confident. She deepened it with blunt dissection, creating a path through the muscle layers. Her fingers swept through the opening to confirm placement, feeling the rush of trapped air escape. The patient gasped, a deep, shuddering breath. Liv inserted the chest tube in one fluid motion, advanced it into the pleural space, and secured it with sutures, the same interrupted military-style pattern she'd used in Teresa Vaughn's abdomen. 8 minutes from the moment the patient arrived to the moment the tube was connected to the drainage system and air was actively evacuating from his chest, the monitors changed. Oxygen saturation climbing 90%, 93%, 96%. The patient's color improved from gray to pink. His breathing eased. Dr. Pierce glanced over, surprised. Portable chest X-ray to confirm placement. The radiology tech wheeled over the machine and took the image. 30 seconds later, it appeared on the mounted screen. The tube was perfectly positioned. Pierce walked over, studying the image and then the patient. "That was fast work, Dr. Martinez." "Thank you. Where did you train?" Before Liv could answer, Dr. Chen's voice cut through the department. "I need another surgeon in Bay 3. Webb is bleeding into his chest. I can't find the source, and cardiothoracic is 20 minutes out." Pierce looked at the board. Everyone was occupied. No one was available except Liv. "Martinez, can you assist Dr. Chun?" Liv moved toward Bay 3 before the question was fully asked. Marcus Webb was deteriorating fast. His chest was open, Chen's hands inside trying to control bleeding that seemed to be coming from everywhere and nowhere at once. "Suction," Chen barked. "I can't see anything." Liv stepped to the opposite side of the table. She looked at the open chest cavity, at the pattern of injury, at the way the blood was pooling, and something clicked. She'd seen this before. Not from a car accident, but from shrapnel, from the fragmentation pattern of an IED that sent metal in predictable trajectories through human tissue. The rebar that had impaled Webb during the collision had acted like shrapnel, and the bleeding pattern matched. "It's not one source," Liv said quietly. "It's 3 small vessels torn by the initial impact. The blood is tracking along the pleural space and pooling at the diaphragm." Chun looked up at her. "How can you possibly know that?" "The pattern. I've seen it before." "In urgent care?" Liv didn't answer. She reached for a clamp. Permission to assist with repair. Chun looked at Webb's monitor. Blood pressure was 60/30. Heart rate climbing to 140. They were losing him. "Do it." Liv's hands moved into the chest cavity with absolute confidence. She identified the first bleeder within seconds, a small intercostal artery that had been partially transected. She clamped it, tied it off, moved to the next. Her movements were economical and precise, no hesitation, no wasted motion. Chun watched her work with growing disbelief. Those are combat trauma techniques. They work in civilian trauma, too. That's not an answer. Liv found the second bleeder, a branch of the internal mammary artery, clamped, tied, secured. The third source was deeper, near the diaphragm, where Chun hadn't been able to visualize it properly. Liv used retraction with her left hand while her right controlled the vessel. Suction here, she directed the surgical tech. The field cleared. The vessel was visible. One more clamp, one more tie. The bleeding stopped. The chest cavity, which had been filling with blood faster than they could remove it, was suddenly still. Chun checked the monitor. Blood pressure starting to rise. 65/35, 70/40. He's stabilizing, the anesthesiologist reported. Liv stepped back from the table, stripping off her blood-soaked gloves. Marcus Webb, still sedated, lay breathing steadily. His color was improving. The monitors showed strengthening vitals. In the observation area above the trauma bay, 3 residents stood watching through the glass. Davidson's face was pale. "Did you see that?" Priya stood with her arms crossed, her expression unreadable. Behind her ear, just barely visible when she turned her head, was a photograph on her phone screen. A military field hospital, soldiers in combat gear, and in the center a woman in surgical scrubs with her hair pulled back, blood on her gloves, surrounded by wounded men on stretchers. The caption underneath, partially redacted, "Medical personnel at Forward Operating Base, Kandahar Province, 2018. The woman in the photograph looked exactly like Liv Martinez. Chun was staring at Liv across the trauma bay. "I want to know who you really are." Liv looked directly into his eyes. "I'm a resident, doing my best to save lives." "That's not good enough." The wall intercom crackled to life. "Dr. Chun, cardiothoracic is en route for Lieutenant Webb, ETA 25 minutes and 33 seconds. Chun remained still, unfazed. "My office after this shift is over." Liv offered a single, curt nod. She walked out of the trauma bay, brushing past the other residents, past Priya, who watched her every move with knowing eyes. In Bay 5, her pneumothorax patient was sitting upright, breathing easily, and talking to his wife, who had just arrived. In Bay 3, Marcus Webb's vital signs were continuing to improve and strengthen. Both men because of Liv. And Liv's secret was unraveling faster than any surgery she had ever performed in her life. The shift ended at 7 a.m., but Liv didn't leave the hospital. She sat alone in the residence lounge with a cup of untouched coffee, watching the steam rise and dissipate in the harsh fluorescent light. Priya entered quietly and sat down across from her. For a long moment, neither of them spoke. "I know who you are," Priya finally said, breaking the silence. Liv's hands remained still around the warm cup. "I'm a surgical resident. You're Captain Olivia Hayes, Army Rangers, Special Operations Combat Medic, 4 tours in Afghanistan and Iraq." Priya placed her phone on the table between them. The screen displayed a partially redacted military document with a photograph. "The Angel of Kandahar, that's what they used to call you." Liv looked at the image. A younger version of herself, exhausted, blood-stained, surrounded by wounded soldiers she'd kept alive against impossible odds. "That person doesn't exist anymore." "She clearly does. I watched her save 3 lives tonight using techniques no civilian resident should know." Priya leaned forward, her gaze intense. "Why are you hiding?" Before Liv could answer, the lounge door opened. Dr. Chun stood in the doorway. "My office now." Liv stood and followed him down the hallway. Priya stayed behind, but her eyes followed them until they disappeared around the corner. Dr. Chen's office was small and cluttered with medical journals and patient files. He closed the door and gestured toward a chair. Liv remained standing. "I'd rather stand." Chun moved behind his desk but didn't sit either. "I've been chief of trauma surgery for 9 years. I've trained over 60 residents. I've worked with combat medics who transitioned to civilian medicine. I know what I saw tonight. Liv said nothing, waiting for him to continue. Those sutures, that decisiveness. The way you identified bleeding patterns in Webb's chest. Chen's voice was controlled but intense. You're not a first-year resident. You're not even a typical surgeon. You're military. Special operations, if I had to guess. I have credentials from... I don't care about credentials. Chun cut her off. I care about competence and I care about honesty. You've demonstrated the first, but you're failing spectacularly at the second. Liv met his gaze, unflinching. I came here to learn civilian medicine, to practice in an environment without war. That's the truth. It's not the complete truth. It's all I'm willing to share. Chun studied her face for a long moment, his expression unreadable. Fine, keep your secrets, but understand this, you're operating at a level that's going to draw attention, questions. Eventually, someone's going to dig deeper than a Google search. I know it, and... The wall intercom interrupted them with a blast of static and urgent voices. Mass casualty event, construction accident at the Embarcadero site. Steel beam collapse. 12 casualties confirmed. Multiple critical. ETA 6 minutes. All available trauma staff report immediately. Chen's jaw tightened. We're not done with this conversation. Understood. They both ran. The emergency department was already mobilizing when they arrived. Nurses prepared trauma bays. Techs wheeled in extra equipment. Dr. Pierce stood at the triage board, dividing incoming patients by severity. First 3 ambulances are 2 minutes out, she called out. Chun, you take Bay 1. Davidson, Bay 2. Sharma, Bay 3. Martinez, Bay 4. Chun didn't argue with her assessment. Pierce nodded without questioning his judgment. The automatic doors burst open, and the first stretcher crashed through. Male, 34, construction foreman, crushed pelvis and lower extremities. BP 80/50, heart rate 120, massive blood loss at the scene. A second ambulance arrived before the first patient was even transferred. Then the third, then the fourth. Within 8 minutes, the department was drowning in casualties. Liv's patient in Bay 4 was a young laborer with a penetrating chest wound from rebar. The metal had been cut away by fire rescue, but 6 inches remained embedded in his torso. She assessed him quickly. Entry point below the right clavicle. Exit trajectory likely through the lung and possibly into the great vessels. He was awake but in shock. What's your name? Liv asked while examining him. Carlos, am I going to die? Not today, she said, trying to reassure him. She looked at the nurse. Get me a trauma panel, type and cross for 6 units, and page vascular surgery. Already paged. They're 30 minutes out. 30 minutes. Carlos didn't have 30 minutes. The rebar had shifted during transport. Fresh blood was seeping around the entry wound. His blood pressure was dropping. 80/45, 75/40. Liv made a decision. We're going to surgery now. Bay 4 is too exposed. Get me O2. Dr. Martinez, you're not authorized. Then find someone who is. But this patient is bleeding into his chest, and I'm not going to watch him die waiting for authorization. The nurse looked at Dr. Pierce, who was managing 2 patients simultaneously in adjacent bays. Pierce glanced over, saw Carlos's monitor, and made the calculation instantly. Take him up. I'll notify the OR. Chen, can you supervise? Chun was elbow-deep in his own patient's abdomen. I can't leave this case. Then Martinez goes solo with remote supervision. She's a first year. She's the only option we have right now. Pierce's voice was final. Move him. They rolled Carlos toward the elevators at a run. In Bay 2, Davidson was struggling with a patient in cardiac arrest. His hands fumbled with the intubation. His voice cracked, giving orders. The patient was crashing. In Bay 3, Priya worked with focused intensity on a woman with a severe head injury, but her eyes tracked Liv's movement toward the elevator. And in Bay 1, Dr. Chun worked on a man whose chest had been crushed by a falling I-beam. The injury pattern was catastrophic. Multiple rib fractures, flail chest, lung contusions, possible cardiac injury. The man on Chen's table was Lieutenant Marcus Webb. The same Marine Liv had saved 4 hours earlier was back in surgery. His previous injuries compounded by being on-site during the construction collapse as part of a training exercise with local emergency responders. Chin didn't know it yet. The patient's face was swollen and covered with blood. The ID had been lost in the chaos of the scene. But in Bay 1's observation area, a military paramedic who'd transported Webb stood watching through the glass. He was older, 45, with the bearing of someone who'd seen combat. His name was Staff Sergeant Raymond Price. He'd served in Afghanistan, and he was staring at Liv Martinez as she disappeared into the elevator with Carlos. "That's her," he said quietly to no one in particular. The nurse nearby looked over, confused. "Who?" "That resident, Martinez." Price pulled out his phone and opened a saved image. A group photo from a field hospital in Kandahar. Soldiers and medical personnel. And in the center, a woman in blood-stained scrubs. "That's Captain Hayes. I'd recognize her anywhere. She saved my life in Fallujah and about 40 other guys I know." The nurse looked at the photo, then toward where Liv had been standing. "You're sure?" "Dead sure." In the elevator, Liv stood next to Carlos's stretcher as they rose toward the surgical floor. His blood pressure continued to drop, plummeting to 70/35. His breathing was labored and shallow. "Stay with me, Carlos." "Trying," he whispered. The elevator doors opened. Your team was waiting, prepped, and ready. They rolled him into or two and transferred him to the surgical table. Liv scrubbed in with practice speed, gowned, gloved, positioned at the table. She looked at the rebar protruding from Carlos's chest, at the monitor showing his weakening vitals, at the clock on the wall showing 1:17 p.m. on what should have been the end of her shift 13 hours ago. And she felt the familiar calm settle over her. The same calm she'd felt in a tent hospital with mortars falling. The same calm when everyone else panicked, and she simply worked. Her hands reached for the scalpel. "Let's go to work." In the emergency department 3 floors below, Marcus Webb's heart rate began to climb rapidly. His blood pressure dropped precipitously. The monitor alarm screamed. Chun looked at the vitals and his face went pale. "He's coding. Start compressions." Staff Sergeant Price stepped closer to the glass, his phone still showing the image of Captain Hayes. And in a quiet office 2 blocks from the hospital, FBI Special Agent Diana Frost received an alert on her computer. Facial recognition had flagged someone. A surgical resident named Liz Martinez matched the biometric profile of a person of interest. Former Army Captain Olivia Hayes. Special Operations. Classified service record. Medical discharge 2 years prior under circumstances that remained partially redacted. Frost picked up her phone and made a call. "This is Special Agent Frost. I need authorization to visit San Francisco General Hospital. We may have located Captain Hayes. The rebar had to come out, but not yet. Remove it too soon, and Carlos would bleed out on the table before Liv could identify which vessels were damaged. Remove it too late, and the continued pressure would cause irreversible tissue damage. Timing was everything." She made the initial incision, extending the wound around the entry point to visualize the trajectory. The metal had entered below the clavicle and traveled downward at a 30-degree angle. "Retractor," she said calmly. The surgical tech placed it in her hand. Liv opened the field carefully, following the path of the rebar with her eyes before her instruments. Your phone rang. The circulating nurse answered, listened, then looked at Liv. "Dr. Chun wants to know your status. Tell him I'm assessing trajectory before removal. Possible subclavian involvement." The nurse relayed the message. A pause. Then he says, "Proceed with caution, and he'll be up in 15 minutes. 15 minutes. Chun was still managing Webb downstairs. Liv continued her assessment. The rebar had missed the subclavian artery by less than a centimeter. Miraculous, but it had torn the subclavian vein and possibly nicked the apex of the lung. "I'm going to remove the foreign body," she announced to the room. "Vascular clamps ready, suction ready. He's going to bleed fast when this comes out." She gripped the rebar with both hands and pulled with steady, controlled force. The metal slid free. Blood filled the surgical field immediately. Suction. Her left hand found the torn vein before she could even see it. Pressure with her fingers. The bleeding slowed but didn't stop. Clamp! She placed it perfectly, isolating the damaged section. The bleeding stopped. Now she could see clearly. The vein was reparable. The lung had a small laceration, but nothing catastrophic. Her hands moved with the same rhythm they'd learned in Kandahar. Stitch, tie, cut. Stitch, tie, cut. Each movement precise and automatic. The repair took 11 minutes. She irrigated the field, checked for additional bleeding, found none. Carlos's blood pressure began to rise. 80/50, 90/60. He's stabilizing. The anesthesiologist reported. Liv allowed herself one deep breath. Closed the chest. I need to check on another patient. She stripped off her gloves and left the OR before anyone could question her. 3 floors down, the emergency department had transformed into something resembling a battlefield triage station. Every bed was full. Patients on gurneys lined the hallways. Staff moved between them in organized chaos. Liv found Dr. Chun in Bay 1, still working on Marcus Webb. She stopped in the doorway when she saw the patient's face. The same Marine she'd saved earlier, now back on the table with new injuries compounding the old. Chun looked up, his expression grim. He arrested twice. We got him back, but he's unstable. Cardiac contusion from the beam impact. I can't get ahead of the bleeding. Liv stepped to the table without asking permission. She looked at Webb's chest, at the pattern of bruising, at the way his heart rhythm was irregular on the monitor, and she recognized the injury. She'd seen it 17 times in combat. Blunt cardiac trauma with associated hemorrhage from intercostal vessels damaged by rib fractures. The bleeding isn't from the heart, she said quietly. It's tracking from the posterior intercostal arteries. The rib fractures severed them. The blood is pooling in the pleural space and compressing the heart. Chun stared at her, incredulous. How can you possibly? Because I've seen this exact injury pattern before multiple times. Liv moved closer. You need to decompress the pleural space and ligate the intercostal bleeders. If you keep focusing on the heart, you're going to miss the actual source. I've been doing this for 25 years, and I've done this specific procedure 43 times in field conditions. Liv met his eyes. Let me help. The monitor alarm screamed. Webb's blood pressure dropped to 50/30. Chun made a snap decision. Show me. Liv positioned herself at the table and placed her hands in Webb's chest. Her fingers traced the ribs, feeling for the fracture points, found them, followed the bleeding path, here and here. She indicated 2 points along the posterior chest wall. These need to be ligated immediately. Chun moved to assist. Together they worked to expose the damaged vessels. Liv's hands led. Chun followed. Within 8 minutes, both arteries were clamped and tied. The bleeding stopped. Webb's blood pressure began to climb. My God! Chun breathed, astonished. You were right. Liv stepped back from the table. Her hands were shaking now, just slightly, the adrenaline finally catching up to her. Chun noticed. Are you? I'm fine. You're not fine. You just performed 2 complex trauma surgeries back-to-back after a full night shift. He gestured to the staff. Someone get Dr. Martinez a chair. I don't need. That wasn't a request. A nurse brought a stool. Liv sat, grateful despite herself. Marcus Webb's monitors continued to improve. His heart rhythm stabilized. His breathing, supported by the ventilator, was steady and strong. Chun stripped off his gloves and moved to stand in front of Liv. I need the truth right now. No evasions. Liv looked up at him, exhausted. What do you want to know? Everything, starting with your real name. Before she could answer, Staff Sergeant Price appeared in the doorway. His eyes locked on Liv's face. Captain Hayes, he said quietly. The trauma bay went silent. Chun looked between them, confused. What did you call her? Price stepped into the room. Captain Olivia Hayes, Army Rangers, Special Operations Combat Medic. He pulled out his phone and showed Chun the photograph. She saved my life in Fallujah and probably 50 other soldiers I served with. Chun looked at the photo, at Liv, back to the photo. Captain Hayes died 2 years ago, Price continued. Medical discharge following an incident in Kandahar. Except apparently she didn't die. She just disappeared. Liv stood slowly, her shoulders slumping slightly. Sergeant Price. Ma'am. He nodded with respect. Good to see you're still saving lives. I'm not. She stopped, defeated. There was no point in denying it anymore. I'm not that person anymore. With respect, ma'am, I just watched you save Lieutenant Webb using the exact same techniques you used on me 7 years ago. You're exactly that person. Chen's expression had shifted from confusion to understanding to something close to awe. You're military, special operations, medical. I was. How many tours? Liv hesitated. 4. How many combat surgeries? I didn't keep count. Yes, you did. Chen's voice was gentle now. People like you always count. Liv looked at Marcus Webb's unconscious form on the table, at the monitors showing his strengthening vitals, at her own hands, still slightly trembling. 812, she said quietly. Give or take. The number hung in the air. Chun sat down heavily on another stool. 812. Field hospitals, forward operating bases, makeshift surgical tents. Liv's voice was flat, reciting facts to avoid feeling them. Kandahar, Fallujah, Mosul, Helmand Province, anywhere they needed someone who could keep soldiers alive long enough to reach real hospitals. And the incident that ended your service? Liv's jaw tightened. That's not relevant. It absolutely is relevant if you're practicing medicine under a false identity. It's not false. Martinez is my mother's maiden name. My credentials are legitimate. I went back to school, completed a civilian residency qualification program, and applied properly. But you didn't disclose your military background. I disclosed what was required. That's evasion, not honesty. The wall intercom crackled before Liv could respond. Dr. Chun, you have visitors in the main lobby. They say it's urgent. Chun pressed the intercom button. I'm in the middle of their FBI, doctor. They're asking for Captain Hayes. The trauma bay went completely still. Chun looked at Liv. Price looked at Liv. Even the nurses stopped moving. Liv felt her carefully constructed civilian life collapsing like a house made of surgical gauze. Send them to my office, Chun said into the intercom, his voice calm. He turned to Liv. You're going to tell me everything, and then we're going to figure out how to handle this together. There's nothing to handle. I haven't done anything illegal. Then why are you running? Liv looked at Marcus Webb again, at the man whose life she'd saved twice in one night, at the monitors showing a heartbeat that wouldn't exist without her skills. Because some people are better at saving lives than living them, she said quietly. Then she walked out of the trauma bay, past the other patients, past Priya, who stood watching with knowing sadness in her eyes, toward the elevator that would take her to Chen's office, where 2 FBI agents were waiting to ask her questions she'd spent 2 years trying not to answer. Special Agent Diana Frost was 42 years old with silver threading through brown hair she kept pulled back in a style that suggested function over fashion. She wore a dark suit and an expression of professional neutrality that Liv recognized immediately as the face of someone who'd spent years learning not to show what they were thinking. The second agent was younger, maybe 30, with the rigid posture of someone new enough to the job that he still stood at attention even when sitting down. His nameplate read, Agent Torres. Dr. Chun sat behind his desk, the only one in the room who appeared even remotely at ease. Liv stood near the door, arms crossed, already calculating exit strategies she knew she wouldn't use. Captain Olivia Hayes, Frost said, not as a question, but as a statement of fact. That's not my name anymore, Liv said, trying to assert control over the situation. Legally, it is. You never filed for a name change. You just started using your mother's maiden name on applications and identification. Frost opened a tablet and scrolled through information. Which isn't illegal, but it is interesting, especially for someone with your service record. My service record is sealed. Most of it, not all. Frost looked up, her gaze unwavering. For tours. Special operations combat medic attached to ranger units. Classified missions in 3 countries, over 800 documented trauma surgeries, 3 commendations for surgical excellence under fire, and a medical discharge following an incident in Kandahar province on March 14, 2 years ago. Liv's jaw tightened at the mention of the date. Chen noticed. "What happened in Kandahar?" he asked quietly, concern etched on his face. Liv said nothing, refusing to revisit the memory. Frost continued, filling the silence. A field hospital at Forward Operating Base Chapman came under attack. Mortar fire. Captain Hayes was performing surgery on 2 critically wounded Rangers when the first shell hit. She had 11 patients in various stages of treatment. Agent Frost. Liv's voice was controlled but cold, laced with a warning. "If you're here to arrest me, do it. If not, I have patients who need care." "We're not here to arrest you," Frost said, her tone remaining level. "We're here because your medical discharge paperwork was never fully processed. Technically, you're still on reserve status, which means when your name was flagged in our system, protocol requires follow-up." "Flagged how?" Liv asked, her suspicion growing. Torres spoke for the first time, his voice stiff. "Facial recognition software, routine security sweep of public facilities, including hospitals. Your face matched military biometric database. That's a violation of standard security procedure," Liv stated flatly. Frost interrupted, cutting off any further argument. "And before you lawyer up, understand that you're not in trouble. The discharge paperwork issue is administrative. We can resolve it today." Chun leaned forward, his gaze sharp. "Then why send 2 federal agents instead of making a phone call?" Frost's expression shifted slightly, almost sympathetic, a rare crack in her professional facade. "Because Captain Hayes's service record includes classified operations. When someone with that background disappears into civilian life without proper discharge processing, we have to verify they're not compromised." "Compromised?" Liv repeated, the word hanging in the air like a threat. "You think I'm a security risk? We have to rule it out. I've been working as a surgical resident for 6 weeks. Before that, I was in a civilian medical qualification program for 18 months. Before that, I was trying to forget the hell I spent 8 years watching people die in." Liv's voice remained level, but something sharp and edged slipped into it, a hint of the pain she tried so hard to bury. "I'm not compromised. I'm tired." The room went quiet, the silence heavy with unspoken questions and lingering suspicions. Frost studied Liv's face for a long moment, searching for any sign of deceit. The incident in Kandahar. What happened after the mortar stopped? Liv looked away, unable to meet her gaze. "That's in the sealed portion of my record. I have clearance." "Then you already know. I want to hear it from you." Chun stood, his protectiveness flaring. "Agent Frost, with respect, this sounds like an interrogation. If Dr. Martinez?" He caught himself, correcting his slip. "If Captain Hayes isn't under investigation, then I don't see why." 6 children died, Liv said suddenly, cutting him off. Her voice was flat, devoid of emotion. "Local contractors' kids. They were in the compound when the attack started. The Rangers pulled them into the medical tent, thinking it was the safest place. It wasn't." She turned to face Frost directly, her eyes now filled with a distant, haunted look. "I had 2 Rangers on the table, critical injuries. Both would have died without immediate intervention. And I had 6 children bleeding out 10 feet away, shrapnel wounds, survivable if treated quickly." Liv's hands clenched into fists at her sides, the knuckles white. "I made the choice to finish the surgeries I'd started. Military personnel first. That's protocol. That's training. That's what I did." "And the children?" Chun asked softly, his voice barely a whisper. "By the time I got to them, for were already gone. I saved 2, lost the other 4 on the table." Liv's voice didn't waver, but her eyes were distant, seeing something beyond the office walls. "The Rangers lived, both of them. They went home to their families, and 6 parents in Kandahar buried their children." Frost closed her tablet, the click echoing in the silent room. "The after-action report said you performed flawlessly under impossible circumstances. Your commanding officer recommended you for a Silver Star. I turned it down." "Why?" Because I don't deserve recognition for choosing who lives and who dies based on what uniform they're wearing. Torres shifted uncomfortably, the weight of her words heavy in the air. Chen's expression was pained, his sympathy evident. Frost remained neutral, her gaze unwavering. The attack was targeted, Frost said, breaking the tension in the room. Intelligence later confirmed. Taliban operatives had mapped the base layout. They knew exactly where the medical tent was located. The mortar fire was precise. You were set up. Liv's head snapped toward her, her eyes wide with disbelief. What? There was an insider, an Afghan interpreter working for the Taliban. He provided the attack coordinates. Frost opened her tablet again and turned it toward Liv, displaying the information on the screen. This was declassified 6 months ago. Liv stared at the document on the screen, her mind struggling to process the information. Declassified intelligence report. Names redacted, but details clear. The interpreter, the coordinates, the deliberate targeting. Why wasn't I told? The question was barely a whisper, laced with a mixture of anger and betrayal. The investigation took 18 months. By then, you had already put in your paperwork to get out and disappeared. Frost's voice became a little softer. It wasn't your fault, Captain. You were set up. Liv slowly sat down in the chair she'd been avoiding. Her hands were shaking again. Chun walked around the desk and put a hand on her shoulder. You've been carrying this around for 2 years, thinking you made the wrong decision. I did make a decision. 6 kids died because of it. 6 children died because a terrorist gave the coordinates to the mortar teams, Frost corrected. You saved 2 kids and 2 rangers who were under fire. Most surgeons would have frozen. You didn't. That doesn't bring them back. No, it doesn't. Frost stood up. But it also doesn't make you responsible for their deaths. Torres pulled out a folder. We need you to sign these discharge papers, make everything official, and close the administrative loop. After that, you're free to go back to your civilian life without any more problems. He put the papers on Chen's desk. Liv looked at them but didn't reach for them. That's it? Sign these papers and this goes away? The administrative issue? Yes. Frost paused. But there's something else. The Department of Defense is putting together a new trauma training program, combat casualty care protocols for both military and civilian uses. They're looking for someone with field experience to help develop the curriculum. I'm not interested in going back. You wouldn't be going back. You'd be helping to train the next generation of military medics and civilian emergency physicians, teaching them what you learned so they can save more lives. Frost looked her in the eye. The program director specifically asked for you when your name came up. Who's the director? Colonel Sarah Reeves. She was your commanding officer in Fallujah. Liv's face changed. Recognition and something else. Maybe respect. Colonel Reeves said you're the best combat surgeon she ever served with. She also said you'd probably say no because you're stubborn and carrying guilt that isn't yours to carry. Frost gave a small smile. Her words, not mine. Chun looked at Liv. This could be really important work. I have an opening here. You could do both. Consulting doesn't take a full-time commitment. Frost pulled out a business card and put it next to the discharge papers. Think about it. Call Colonel Reeves if you want more information, but either way, sign the papers so we can properly close your file. Liv picked up the pen. Her hand hovered over where she was supposed to sign. 2 years of running. 2 years of hiding behind a different name and pretending the past didn't exist. 2 years of thinking she'd failed when she'd actually been fighting against impossible odds created by betrayal. She signed Olivia Hayes, her real name, for the first time in 2 years. Torres picked up the papers. You're officially discharged. Thank you for your service, Captain. Frost held out her hand. Liv shook it. One more thing, Frost said. The 2 rangers you saved in Kandahar, Sergeant Paul Morrison and Corporal James Chun, both are alive. Both have families now. Morrison has twin daughters. Chun just had his first son. They asked me to tell you thank you if I ever found you. Liv's composure finally broke. Tears welled up, but she didn't cry. They're okay. They're more than okay. They're living full lives because of you. After the agents left, Chun and Liv sat in silence for several minutes. "What are you going to do?" he finally asked. "I don't know. You could stay here, not as a first-year resident hiding in the shadows, but as a senior trauma surgeon with full privileges. We need someone with your skills." Chun leaned back in his chair. "I'll talk to the board. Get you properly credentialed under your real name. You could lead a trauma program. Maybe even use some of that military training." Liv looked at her hands. "Steady now. Surgeon's hands. Soldier's hands. I spent 2 years trying to forget who I was. Maybe the answer isn't forgetting. Maybe it's becoming who you were always meant to be." The office phone rang. Chin answered it. He listened. His face lit up. "Lieutenant Webb is awake. He's asking for the doctor who saved him." Liv stood up. "I should check on Carlos, too." Before she could leave, Chun stopped her at the door. "I owe you an apology. I judged you based on appearances and credentials instead of competence. That was wrong. You were following protocol. Protocol doesn't say lie. People like you do." He held out his hand. "It's an honor to work with you, Captain Hayes." Liv shook his hand. "It's just Liv, and the honor is mine, Dr. Chun." She left the office and walked through the emergency department. It was quieter now. The mass casualty event was over. Patients were stable or in surgery. The chaos had become routine efficiency. Priya was at the nurse's station. She looked up as Liv approached. "FBI gone?" "Yeah. You okay?" "Getting there." Liv paused. "Thank you for not saying anything earlier when you figured it out. Your past is your story to tell, not mine." Priya smiled slightly. "But for what it's worth, I think you should stop hiding it. The world needs more surgeons who don't give up when everyone else does." Liv nodded and continued toward the ICU where Marcus Webb was waiting. Marcus Webb was sitting up when Liv entered his ICU room. His chest was wrapped in bandages, tubes still connected to monitors, but his eyes were clear and alert. The gray color of shock had been replaced by a healthy glow. Staff Sergeant Price stood near the window. He straightened up when Liv walked in. Webb looked at her, and his expression changed to recognition, not from the surgeries, but from something deeper. "You're Captain Hayes," he said. His voice was rough from being intubated, but steady. "I heard the stories. Never thought I'd meet you." "I'm just a doctor." "No, ma'am. You're the Angel of Kandahar. Every Marine who served in that region knows your name." Webb gestured at his chest. "Price told me what happened, that I coded twice and you brought me back both times using field protocols." Liv checked his monitors, avoiding his gratitude. "How's your pain level?" "Manageable." "Doc, I need to say something." "You need to rest." "I need to say thank you for not giving up on me." Webb's eyes were intense. "My wife is 8 months pregnant. Our first kid, a daughter. If you'd stopped when my heart did, she'd be growing up without a father." Liv's hands stilled on the monitor controls. "You have a family waiting for you. That's enough motivation for any doctor. But you didn't know that when you were working on me. You just knew you could save me, and you did." Webb reached for the small table next to his bed and pulled out his phone. He showed Liv a photo of a woman with dark hair and a beautiful smile, her hand resting on her pregnant belly. "Her name is Sophie. We're naming the baby Grace." "That's beautiful. I'm going to tell Grace about you someday. About the doctor who made sure her dad came home." Liv felt the familiar tightness in her chest. The weight of lives saved and lives lost. The impossible math of emergency medicine, where success was measured in heartbeats and failure in silence. "Just focus on healing," she said quietly, "so you can be there when Grace arrives." She left before Webb could say anything else. Carlos was 3 rooms down, also awake, also surrounded by family. His wife and 2 young children stood near his bed. The kids were drawing pictures with crayons the nurses had given them. Carlos saw Liv and smiled. "There she is, the miracle worker. How are you feeling?" "Like I got hit by a steel beam, but alive." He reached for his wife's hand. "Maria, this is Dr. Martinez, the one who saved me." Maria's eyes filled with tears. She stepped forward and hugged Liv before she could react. Thank you. Thank you so much. I was just doing my job. You did more than that. The nurse told me you took him to surgery when no one else was available, that you operated alone. Maria pulled back, still holding Liv's hands. Our kids still have their father because of you. The two children looked up from their drawings. The older one, maybe 7 years old, held up a picture. I made this for you. It was a crayon drawing of a person in blue scrubs with a big smile and a heart on their chest. The words, "Thank you, Doctor," were written carefully across the top. Liv took the drawing. Her throat tightened. This is perfect. Thank you. Dad says you're a hero. Your dad's the hero. He stayed strong while we fixed him up. She stayed for a few more minutes, checking Carlos's surgical site and reviewing his recovery plan with Maria. Then, she excused herself and walked back through the ICU toward the elevators. Dr. Chun was waiting near the nurse's station. Word travels fast in hospitals, he said. Half the staff knows you're military now. The other half thinks you're some kind of surgical prodigy. Both groups want to work with you. Chun continued. Before you deflect, I talked to the chief of surgery and the hospital board. We want to offer you a position. Senior trauma surgeon with modified residency requirements. You'd complete the program in 2 years instead of 5, given your experience. Full surgical privileges effective immediately. Liv shook her head. I can't accept special treatment. It's not special treatment. It's recognition of existing expertise. We're not giving you anything you haven't already earned. Chun pulled out a folder. The position comes with 3 conditions you set yourself. First, you establish a trauma training program incorporating combat casualty care protocols. Second, you get complete autonomy in surgical decision-making. Third, you choose your own team. You talked to the board about this already? I called an emergency meeting an hour ago. Showed them your surgical outcomes from the last 24 hours. 3 complex trauma cases, 3 perfect results, 0 complications. Chun handed her the folder. They want you here, Liv. Not as a resident in training, but as a leader who can elevate our entire trauma department. Liv opened the folder and scanned the formal offer. Senior trauma surgeon position. Salary significantly higher than resident stipends. Start date flexible. Teaching responsibilities included. This is too much. It's exactly what you deserve. Chen's voice was firm. You spent 8 years saving lives in war zones. You don't need to hide that experience. You need to use it to save more lives here. Liv thought about Marcus Webb's daughter, who would grow up with her father. About Carlos's children drawing pictures with crayons. About Teresa Vaughn, who'd survived septic shock. About the 2 rangers in Kandahar who were alive and raising families. She thought about the 6 children she couldn't save. The faces she saw every time she closed her eyes. What if I fail? The words came out quieter than she intended. You won't. You don't know that. I know you succeeded 812 times under conditions infinitely worse than anything you'll face here. I know you brought back 43 people everyone else had given up on. I know you see patterns other surgeons miss, and you act when others hesitate. Chun stepped closer. Failure isn't your problem, Liv. Forgiveness is. What? You haven't forgiven yourself for Kandahar. For making an impossible choice in an impossible situation. So, you've been punishing yourself by hiding, by pretending to be less than what you are. His voice softened. But those 6 children wouldn't want you to stop saving lives. They'd want you to save more. In their memory. Liv's eyes burned. She blinked hard. How do you know what they'd want? I don't. But I know what I'd want if I were them. I'd want my death to mean something, to motivate someone to save others, not to destroy the person who tried to save me. The ICU around them continued its steady rhythm. Monitors beeping, nurses making rounds, life persisting against entropy and injury and chaos. Liv looked at the folder again, at her real name printed on the contract. Captain Olivia Hayes, MD, not hiding anymore. Not running. I need time to think. Take all the time you need. The offer stands. Chun turned to leave, then paused. One more thing. Colonel Reeves called the hospital. She wants to talk to you about the DoD training program. I gave her your number. I hope that's okay. You're very presumptuous. I'm very determined to keep you here. Chun smiled slightly. Welcome back, Captain. 3 weeks later, Liv stood in the simulation lab at San Francisco General. 20 residents and attending physicians filled the seats, notebooks open, attention focused. Behind her, a screen showed combat casualty scenarios. Beside her, mannequins were arranged to simulate mass casualty triage situations. She wore scrubs with her real name embroidered on the pocket. Dr. Olivia Hayes, Senior Trauma Surgeon. Combat medicine and civilian trauma care aren't as different as you might think, she began. Both require rapid assessment, decisive action, and the ability to prioritize under pressure. Today, we're going to cover battlefield resuscitation techniques adapted for emergency departments. Priya sat in the front row taking notes. Dr. Chun stood in the back, watching with approval. On the wall near the door, Carlos's daughter's crayon drawing was framed and mounted, a reminder of why the work mattered. Liv walked through the first scenario, demonstrating triage protocols developed over 4 tours and 800 surgeries. The residents watched intently, absorbing every word. She was teaching them to save lives, passing on knowledge earned in the hardest classrooms imaginable, making sure the next generation would be better prepared than she'd been. After the session ended, a young resident approached hesitantly. Dr. Hayes, I'm prior military Navy corpsman. I've been worried my background would be seen as a disadvantage in civilian medicine. Liv looked him in the eye. Your background is your strength. The question is whether you're ready to stop hiding it and start using it. He nodded slowly. Thank you, ma'am. It's just doctor now. And thank you for your service. As the lab emptied, Liv's phone buzzed. A text from Colonel Reeves. Heard your first training session went well. DoD wants to expand the program nationally. Interested in leading the initiative? Liv looked at the empty simulation lab, at the training equipment, at the crayon drawing on the wall. She typed a response. Yes, let's talk details. Another message came through. This one from Marcus Webb. A photo of him holding a tiny newborn with dark hair and perfect features. The text read, Grace Olivia Webb, born this morning, named after the angel who gave her father a second chance. Thank you. Liv stared at the photo, at the new life that existed because she hadn't given up, at the middle name that honored what she'd been and what she'd become. She saved the image and walked out of the simulation lab. There were patients waiting, lives to save, knowledge to share. She wasn't running anymore. She was exactly where she was meant to be. 6 months later, the trauma department at San Francisco General had been transformed. The Hayes Combat Medicine Institute occupied the entire 3rd floor of the surgical wing. State-of-the-art simulation equipment filled 4 training rooms. Mannequins with programmable vital signs and realistic wound patterns allowed residents to practice high-pressure scenarios without real-world consequences. On the wall near the entrance, a plaque read, In memory of those we couldn't save, in service to those we still can. Liv stood in the main lecture hall, addressing 60 physicians from hospitals across California. The quarterly training symposium had grown beyond anyone's expectations. Emergency medicine directors, trauma surgeons, military medics transitioning to civilian practice. All of them were here to learn protocols developed in the crucible of combat and adapted for everyday emergencies. Survival rates for penetrating chest trauma have improved 31% since we implemented these protocols 6 months ago, Liv explained, clicking through data slides. Not because the medicine changed, but because the speed and decisiveness of intervention changed. She walked through a case study. Multi-vehicle collision, patient with tension pneumothorax. Time from diagnosis to chest tube placement reduced from an average of 18 minutes to 7. Every minute matters. Every hesitation costs lives. Combat medicine taught me that the difference between a survivor and a statistic is often just someone willing to act when everyone else is still thinking. After the lecture, residents and attending physicians lined up to ask questions. Liv answered each one with patience, remembering when she was the one asking questions, learning how to keep people alive against impossible odds. Dr. Chun appeared at the edge of the crowd, waiting. When the last question was answered, he approached. Department of Defense called again. They want to expand the program to 15 more cities. Federal funding approved. Colonel Reeves is flying in next week to discuss implementation. Liv nodded. That's good. More trauma centers need this training. There's something else. FEMA contacted us. They want to incorporate your mass casualty protocols into their disaster response training. National level. Chun handed her a folder. They're offering a consulting position. You would help design the curriculum for first responders across the country. How would that work with my responsibilities here? You'd keep your position as senior trauma surgeon. The consulting would be part-time, mostly remote, with occasional travel. Chun smiled. You've become exactly what I hoped for when I first saw you work. A leader who elevates everyone around her. I had good teachers. You had experience no teacher could provide. You just needed to stop hiding it. Priya joined them, tablet in hand. Dr. Hayes, your 4 o'clock is here. The Transition Support Group. Thanks. I'll head there now. The Transition Support Group met every Thursday in a conference room overlooking the city. 10 military veterans, all medical personnel, all struggling to find their place in civilian medicine. Liv had started the group 3 months ago when she realized she wasn't the only one carrying the weight of service and wondering if those skills had any value outside of combat zones. She entered the room and took her usual seat in the circle. Faces she'd come to know well looked back at her. Former combat medics, Navy corpsmen, Air Force PJs, all of them trying to translate battlefield experience into hospital credentials. Who wants to start? Liv asked. A young woman named Sarah raised her hand. 26 years old, former Army medic, 2 tours in Iraq. I had an interview at County General yesterday. The attending asked about my medical training, and I told him about my combat experience. He said, field medicine doesn't count as real clinical practice. Anger moved through the group. Liv felt it too but kept her voice calm. What did you tell him? Nothing. I just thanked him for his time and left. Sarah's hands clenched. But I wanted to tell him I've performed more trauma interventions under fire than he's probably done in his entire career. I wanted to tell him real means keeping someone alive when mortars are falling, and you're out of morphine, and the nearest hospital is 30 miles away. You should tell him that, Liv said quietly. What? Call him back. Ask for a second conversation. Tell him exactly what you just told us. Liv leaned forward. Your experience isn't something to apologize for or minimize. It's expertise that civilian medicine desperately needs. But you have to own it. You have to make them see its value. What if he still says no? Then you go to the next hospital and the next one until you find someone who recognizes what you bring, because there are people who will value your skills. I promise you that. Another member spoke up. James, former Navy corpsman, 32 years old. How did you do it, Dr. Hayes? How did you go from hiding your background to leading a training institute? Liv considered the question. I stopped believing the lie that I had to be less than what I was to fit into civilian medicine. I stopped running from the parts of my past that made me who I am. She looked around the circle. You all have skills that can save lives, knowledge earned in the hardest possible conditions. The question isn't whether you're qualified. The question is whether you're brave enough to claim that qualification. The meeting continued for another hour. Stories shared, advice given, support offered. When it ended, Sarah approached Liv privately. Will you write me a recommendation letter for County General? Absolutely. And I'll call the chief of surgery directly. She's a friend. Sarah's eyes filled with tears. Thank you for everything, for showing us we don't have to hide. After Sarah left, Liv returned to her office. It was small but functional, with a window overlooking the city and a desk covered in research papers and training proposals. On the wall, 3 photographs hung in simple frames. The first showed a field hospital in Kandahar. Liv in blood-stained scrubs, exhausted but focused, surrounded by wounded soldiers, a reminder of where she'd come from. The second showed the simulation lab filled with residents during a training session. Carlos's crayon drawing visible in the background, a reminder of why the work mattered. The third showed Marcus Webb holding baby Grace with his wife, Sophie, beside them. The photo had been taken last month when they visited the hospital. Grace was 6 months old now, healthy and alert, reaching for everything with tiny, curious hands. Marcus sent Liv a photo every month. Pictures of Grace growing, learning to smile, learning to grab. Soon, she'd be learning to crawl, to walk, to talk, living a full life because her father had survived impossible injuries. 43 people. That's how many Liv had brought back when everyone else had given up. And each of those 43 had families, friends, futures that wouldn't exist without those moments of stubborn refusal to accept death. The number used to haunt her. Now it grounded her. Her phone buzzed. A text from an unknown number. Dr. Hayes, this is Sergeant Paul Morrison. Agent Frost gave me your contact. I'm one of the Rangers you saved in Kandahar. I wanted to thank you and tell you my daughters just turned 5. Twins, Emma and Sarah. They're the light of my life. Thank you for giving me the chance to be their father. Liv stared at the message. Morrison. She remembered him. Critical abdominal injuries, bleeding that wouldn't stop. Everyone thought he was gone. But she'd kept working, kept trying, kept refusing to quit. He'd lived, and now he had twin daughters. She typed a response. Thank you for letting me know. Give Emma and Sarah a hug from me. And thank you for your service. Another message came through immediately. My wife wants to name our next baby after you if it's a girl. Would that be okay? Liv smiled through sudden tears. That would be an honor. She set down her phone and looked out the window at the city stretching toward the bay. Millions of people living their lives. Some of them walking around healthy because someone refused to give up on them. Some of them not even knowing how close they'd come to not being here. Her mission was about those moments. The ones where death seemed inevitable until someone decided it wasn't. The ones where protocol said stop, but instinct said keep going. The ones where the difference between tragedy and miracle was just stubbornness, skill, and an absolute refusal to back down from the unacceptable. These were the qualities that ran through her mind when a knock at her door interrupted her train of thought. Dr. Chun entered without so much as a pause for permission. We have a situation. Young resident downstairs, first year. An attending is dismissing her for suggesting an alternative diagnosis for a stable patient. The attending is Dr. Harrison from cardiology. What's the diagnostic dispute? She thinks the patient has early signs of aortic dissection. Harrison says it's just anxiety. He's refusing additional imaging and told her to stop questioning his clinical judgment. Liv didn't hesitate. She stood up immediately. Take me to them. They found the attending and resident in the hallway just outside the cardiac unit. Dr. Harrison was a man in his mid-50s, radiating that confident arrogance that comes from practicing medicine long enough to believe you're always right. The resident was young, maybe 27, buzzing with nervous energy but with a determined glint in her eyes. Her name tag read Dr. Andrea Chin. No relation to Robert Chin based on the different specialty. Dr. Harrison, Liv said, her voice calm but firm. I understand there's a diagnostic disagreement. Harrison turned, irritation plain on his face. Dr. Hayes, this doesn't concern trauma surgery. This is a cardiac case and I'm the attending. What are the patient's symptoms? Chest pain, elevated blood pressure, anxiety, classic panic attack presentation. I've prescribed anxiolytics and observation. Liv turned her attention to Andrea. What makes you think it's aortic dissection? The pain pattern. He described it as tearing, radiating to his back. His blood pressure is different in each arm, a 20-point discrepancy. And he has a history of hypertension. Andrea's voice was steady despite the glare Harrison was giving her. Those are red flags for dissection, even if imaging doesn't show it yet. Early dissection can be subtle on initial studies, Liv said, backing up Andrea. Easily missed if you're not specifically looking for it. I've been practicing cardiology for 30 years, Harrison said coldly. I think I know the difference between a dissection and anxiety. Then you'll have no problem ordering a CT angiogram to confirm your diagnosis. Liv countered. That's unnecessary radiation exposure and resource waste for a clear anxiety case. And if Dr. Chun is right and you're wrong, the patient dies when the dissection ruptures. Liv's voice remained calm but carried absolute authority. Order the scan or I will. You don't have the authority. I'm a senior trauma surgeon with full privileges, and I'm formally requesting imaging based on clinical suspicion. That gives me the authority. Liv turned to Andrea. What's the patient's name? Michael Torres. Basics. Liv walked past Harrison toward Basics, Chun and Andrea close behind. Harrison hesitated for a moment, then came after them, anger practically radiating from every step. Michael Torres was in his late 40s, sitting up in bed, looking uncomfortable but stable. His monitor showed elevated blood pressure at 165/95. Mr. Torres, I'm Dr. Hayes. I'd like to examine you briefly. Sure. Everyone keeps saying it's just anxiety, but the pain feels wrong. Liv checked his blood pressure in both arms. Right arm, 165/95. Left arm, 142/88. A 23-point discrepancy. She palpated his chest, felt the quality of his peripheral pulses, listened to his heart sounds. Everything Andrea had described was there. Subtle, easy to dismiss, but undeniably present. I'm ordering a CT angio, Liv said. It's a precaution, but I want to rule out a vascular issue. Thank God someone's listening, Michael said, a clear note of relief in his voice. I know my body, and this isn't anxiety. The scan was done within 40 minutes. Liv stood in the imaging reading room with the radiologist when the results popped up on the screen. There it was, a small dissection in the descending aorta. Early stage, still contained, but absolutely present and absolutely life-threatening if left untreated. The radiologist whistled quietly. Good catch. Another few hours and this could have ruptured. Liv returned to Bay 6, where Harrison and Andrea waited with very different expressions. Harrison's arrogance had been replaced by a pale, dawning realization. Aortic dissection, early stage, Liv announced. Mr. Torres needs immediate transfer to vascular surgery for repair. Harrison said nothing, his face ashen. Andrea's relief was palpable. Thank you, Dr. Hayes. You made the diagnosis. I just refused to let it be dismissed. Liv turned to Harrison, her voice firm. Dr. Chun showed excellent clinical judgment. You should acknowledge that. Harrison cleared his throat, visibly humbled. Dr. Chun, you were correct. I apologize for not taking your assessment seriously. Andrea nodded, accepting the apology with grace. Thank you. After Michael Torres was safely transferred to vascular surgery, Liv walked Andrea to the residence lounge. You saved his life, Liv said. Don't ever let anyone make you doubt your clinical instincts. Harrison is one of the most respected cardiologists in the city. I thought maybe I was wrong. Respected doesn't mean infallible. Experienced doesn't mean omniscient. Liv stopped at the lounge entrance. You saw something others missed. You spoke up even when dismissed. That's what good doctors do. How do you stay confident when everyone questions you? Liv thought about the long road from Kandahar to here, about the years of hiding and the choice to finally stop running. Because I've learned that being right matters more than being liked, and saving lives matters more than protecting egos. She smiled slightly. Keep questioning. Keep advocating. That's how you become the doctor your patients need. Liv returned to her office as evening settled over the city. Her schedule showed 3 more training sessions this week, a conference call with the DoD on Monday, and a site visit to a hospital in Seattle interested in implementing the combat medicine protocols. The work was endless. The need was constant. But for the first time in years, Liv felt like she was exactly where she belonged. Her phone buzzed one more time. A message from Colonel Reeves. European Union formally requesting your protocols for their emergency response systems. This is bigger than we imagined. You're changing how the world approaches trauma care. Proud of you, Captain. Liv looked at the 3 photographs on her wall. Past, present, and future. She wasn't the angel of Kandahar anymore. She was something better, a teacher, a leader, someone who turned pain into purpose and loss into lessons that saved lives. The trauma alert sounded in the distance. Somewhere in a hospital, a new crisis was unfolding. Someone needed saving. Liv stood and walked toward the sound, a determined look on her face. Just getting warmed up,